Welcome to the Modern Wellness Podcast. I'm your host, Dr. Mary Pardee. This podcast, along with my private practice in LA and my newsletter, all are aimed to providing you evidence-based information around preventative medicine, longevity, and health in general. Join me in dispelling health myths as well as cutting through the noise that is social media. I hope that whether you want to optimize your performance or just in general get healthier, the Modern Wellness Podcast will help you do that. Today, I'm joined by Dr. Lauren Colenso-Semple. She's an expert in women's exercise physiology, and we unpack the science and what it actually says about training metabolism performance across a woman's lifespan. We cover everything to whether women should really train based on their menstrual cycle, to the truth about bulking versus toning. And we also cover why cardio alone won't cut it. Dr. Lauren Colenso is a muscle physiology researcher and science communicator with expertise in female physiology, exercise, and nutrition. She has her PhD in integrative physiology from McMaster University and a master's in exercise science from the University of South Florida. Her work focuses on the influence of ovarian hormones on exercise-induced adaptations. Lauren is also an expert fitness professional with years of practical experience in strength and conditioning and sports nutrition. She is co-owner of Mass Research Review. I'll put all of that in the show notes, and I really hope you enjoyed today's conversation. Thank you so much for joining me, Lauren. I'm really excited today.
Thank you for having me.
Yeah. So I want to go through all the myths that you talk about on social media. Your social media is amazing. If you guys aren't following her, I'm going to put it in the show notes, her Instagram post, but you must. But let's just start off by talking about how you got into women's exercise physiology in the first place.
I was working as a fitness professional in New York City, and I was just really trying to optimize my own results and the results of my clients at the time. And I decided to go back to school because I became so interested in exercise physiology, muscle physiology specifically, and I really wanted to know the why behind the what, and not just what we should do practically, but why are we seeing these sorts of adaptations? And so I became really interested in more of the kind of molecular and mechanistic side of things, but I've always tried to keep a hand in the practical world because that's really where I came from.
Awesome. And what did you do your dissertation on?
For my PhD, I studied the influence of menstrual cycle phase and also the influence of oral contraceptive pill phase on muscle protein synthesis in response to exercise. So essentially, our is the muscle response, the kind of muscle building potential different in one phase with one hormone profile versus another? And one of the reasons that I was really interested in doing that is A, because we know so much about testosterone and muscle, but we know very little about estrogen and progesterone and muscle. And the other reason is, when I first got into the science, when I did my master's degree, when I subsequently went to do my PhD, I realized that one of the reasons why a lot of scientists were hesitant to study women, or they'd say, I don't have the resources to study women, is because of this sort of unknown influence of the menstrual cycle or hormonal contraceptives. And so that was and still is a big barrier to people, including female participants. And so as a result, they just say, oh, it's just easier to study men, so we'll study men.
Yeah, I mean, we could do a whole podcast just on this one topic. I was hosting a retreat the other weekend, and it was a women's health retreat. And this is one of the first things I brought up is like, we don't have enough research on women, but it doesn't mean we have none. So we do have some, and we need so much more. And there's agencies that hopefully will still be around, that are promoting this equality in research that we have to like really make sure we're supporting and backing.
Yeah, I think we've come a long way, certainly in the past decade or so, in getting a lot more data in women, but certainly in the exercise space, it's a lot harder for some of these labs that don't have as many resources to do impactful work if they also need to only recruit people who are on a specific oral contraceptive, for example, or if they need to standardize testing and training around cycle phase and confirm cycle phase with blood hormones. So the idea that my data and many of the others that are coming out showing that there really isn't a big difference here is actually really exciting for science, in my opinion, because I hope the removal of those barriers will just make it easier and more accessible for those labs that don't necessarily have as many resources to still study female participants.
Yeah, so important. And that's such a great point. Is like we need to get the word out about your research for that exact reason is just to take down those barriers. That's great. And so what was the conclusion of your dissertation in terms of what were the main findings?
The main findings were that the hormone profile, whether be it endogenous during menstrual cycle fluctuations or the introduction of the exogenous hormones with oral contraceptives, we really did not see a difference. So protein synthesis increased in response to exercise as expected, but there wasn't a difference in the high estradiol phase versus the high progesterone phase, and there wasn't a difference between the active pill phase, the inactive pill phase. So across the board, we're start seeing that this really isn't something that you should be worrying about when it comes to exercise.
Yeah, that's huge. That's huge. I mean, you hear it on social media all the time. You should train based on your cycle, or you should avoid things if you're in your luteal phase before your period, or you should only do things in the follicular phase. Um, is there any merit to any of it? Like, is there like any exceptions? Is there like any caveats worth people knowing about? Because I still get it in clinical practice all the time where people will say, yeah, I'm not doing that because I'm in my luteal phase. Like, I need to, just walk or something like that. I'm like, well, do you feel okay? Because one thing if you're debilitated with cramps, I'm like, okay, like let's talk about that. But no, I feel fine, but I heard from this influencer that I should only be doing light walking and meditating right now, and it makes me want to pull my hair out.
It's just nuts. There every day I see something new about how you're not only should you change your exercise, but your nutrition and your lifestyle and your work habits. And I mean,
And your
it's
supplements,
everything,
change your supplements based
all of it.
on it. Yeah.
And I really hate it because A, the evidence isn't there to support these recommendations, and B, it's completely overcomplicating fitness for women. And a lot of these recommendations are actually detrimental. They're not going to help you meet your goal in an efficient way because if we want to lose body fat, gain muscle, get stronger, improve exercise performance, improve health, we need to do things consistently. And we need to do that for physiological adaptations, but also for behavior change purposes. We need to establish these habits. And by constantly changing what we're doing, that doesn't establish habits, that doesn't develop consistency. So all of this is unnecessary, it's confusing, and it's largely ineffective.
Yeah, yeah. I love that you talked about just like overcomplication because that can be extrapolated to almost every area of health that I see. So you're focused really on women's, exercise, but we can talk about nutrition. Like the social media world has overcomplicated nutrition to the point that people are paralyzed in not knowing what to do because everybody is contradicting everything and we're missing like, hey, can we all agree on the big things here? Because if you just do those, you're like 90% there. But I get like heated about this because I come from a background where in my 20s, I was confused and I was listening to podcasts and I was going down all these rabbit holes. And I was one of the people now that I see as a patient where I'm like, I don't know what to do. Like I'm doing all this super complicated things because I just want to feel better. So I really understand that side of it as well because I was there and it makes me even more passionate about saying like, hey, let's dispel all of these things, just stick with the things that we know that are tried and true. And we need to shut down like this whole overcomplication of health in general because it's not actually helping people.
I completely agree. And certainly on the nutrition side and the supplement side, as well as the exercise side. So, I mean, we're getting it from all angles. And I too was someone who wanted to optimize everything, wanted to make sure I was doing everything right. And the problem is once you start going down these rabbit holes, if I'm going to follow this person and take what they sell or what they promote because that's going to get me to where I want to be, it ends up with us focusing on the wrong things. And then often those big picture things that really matter start to fall by the wayside. And so things like, hey, maybe we should have a diet that includes mostly whole foods. And maybe we should try to do some physical activity really consistently. All of a sudden, those things are forgotten, and now we're just focusing on what supplement I should be taking or what seeds should I be eating this week.
Totally, totally. Focusing on the 2% maybe, right? Like the questionable 2% and missing the 98%. 100% agree. Quick story for entertainment purposes only. At one point, again, in my early 20s, I'm laying on an acupuncture table. I feel like this is like when I hit like rock bottom in terms of health fads. Not that I actually love acupuncture. I think there's some research behind it, like no judgment whatsoever. But I'm on an acupuncture table, and this guy who I don't even know is an acupuncturist, but he's attaching electrodes to my stomach, and it's sending electrical signals like through the needles to my stomach to help heal me from constipation. And I always look back at that moment. And at that time in my life, I had orthorexia for sure. I was like scared of eating most foods because of what was said on podcasts. And so I was obsessed with food. I was obsessed with all of the things that maybe I could do to help myself. I wasn't doing any of the things that were evidence-based that I now know would have been the 98%. And I feel like so many people resonate with stuff like this because they're like, oh my God, yeah, like how have I been missing the big chunk of it? And it's not their fault too. It gets really complicated. So I understand it.
It does. And I mean, I think for you and I, we can say, oh, it's such a relief to have sort of come out the other side of that and be able to focus on the basics and not be really influenced by this stuff. But many people are, and they are throughout their whole lives. And right now we see messaging that's not only targeted at women, but targeted at specific age groups of women, or it's women on oral contraceptives, or it's women who are going through the menopause transition. And those are, if you think about a time when everything is kind of confusing and unknown and maybe scary, and then you add misinformation and a whole lot of sales pitchy stuff, often with a fear-based message that kind of cloaks over the whole thing, that is incredibly stressful and it is so unfair. So I feel really passionate about this too. And that's really the only reason I'm even on social media is because I just think it's so unfair that people are really targeting women in this way at a vulnerable time and just taking advantage of that instead of really promoting the simple stuff that we know is effective and we know is important to do long term.
Yeah, I feel ya. I feel ya. Let's dive into some of that stuff. So the 98%, right? Like the big things that we should be thinking about. First, just like what do you do for exercise? And has your knowledge going through your programs and doing all of this research, has it changed what you actually do for exercise?
I lift weights, shocking. And I did that before, so before I was into lifting, I was a really avid runner. And then I got a stress fracture and I was in a boot for 6 months or something. It was really terrible, especially living in New York City, walking with a boot, not great. But that's when I got into lifting because I was really struggling to get back to running. And when if you don't run for that long, you kind of lose it all. And so it was really demotivating. And then that's when I found resistance training and I loved it because I felt empowering that I was making progress and I could kind of track that and see, oh, I'm doing more than I could do last week or last month. And so I just really, really got into it and have my love for it has waxed and waned over the years as things do when you get really busy in certain parts of your life. Certainly when I was in the lab for many, many hours a day, I wasn't doing anywhere near as much lifting, but it's always been a pretty consistent part of my adult life. I like to go more frequently, but for shorter sessions. I just find that that's what works for me. But as far as my changing things based on the science I've done, I'd say not really. What I realized is there's a big, big difference between what's interesting from a scientist's point of view, from a muscle physiology point of view, and then there's what's meaningful from a kind of practical application perspective. And I think it's really important to separate those
Mm,
because I can think, oh, it's really interesting, like if we look at these receptors or these downstream targets, I wonder if that means something. It's another to take that and say, therefore, you should change how you exercise. Um,
right.
so I think I've been consistently reminded that a what we don't need to do very much for it to be really, really meaningful. There are so many ways to exercise and have it be effective, and that's great. There's a lot of flexibility there. And we don't need to, again, overcomplicate it. So, yeah,
The-
although I know all the complicated stuff,
yeah.
that's not what matters when it comes down to the nuts and bolts of training.
Yeah. Yeah, and to zoom out a little bit, because I completely agree. I think my main message for people is do any sort of exercise that you like and that's safe. Just like move your body. And then we can start to get a little bit more into, okay, make sure, let's talk about progressive overloading and make it more effective. And like, you go up the ladder in terms of quote unquote complication, but still keeping it simple and effective. Do you think though, like that, let's move the general public aside because I'm also a huge science nerd. For somebody who is super dialed, right? Like we're talking like Olympic athletes, is some of your research relevant in terms of like tiny tweaks to that population, or is it still stuff that we're like you're digging into and we need more information as to whether it's actually going to move the needle at all?
One thing we see all the time whenever we study anything in this field is there's always a big array of response. So you'll get people doing the same program, but for a variety of reasons, people respond a little bit differently. And so what that means is when we go to report the group averages, as we do in studies, it's not designed to be prescriptive for any one individual.
Yeah.
And so I think when it comes to getting that extra edge, or even if you're not an elite athlete, but you're someone who's really serious about their fitness, individualization is huge, and there is going to be some trial and error, and you see what works for you. And sometimes the science is a great place to start, but it's not going to tell you everything. And that's why we need practitioners and clinicians and
Yeah.
trainers and because there is that individual component.
Right, right. Where you would see on the research paper that was looking at it, there was no difference between groups, and yet you had these outliers or these people that were totally responding to it. And it's like, what is the difference in those individuals? Is it worth a shot in somebody? So yeah, that's really interesting. Um, Again, really back in terms of more the general stuff, what are benefits of strength training, cardio for women specifically? And we'll go into, are there actually any differences for women and men? But if you're a woman, what should you be thinking about when you're talking about exercise and the importance of it?
It's excellent for improving your kind of health longevity because muscle is really important for physical function as we age. Uh, Bone is important for physical function as we age. So exercise is very good for both muscle health and bone health. And it's also important for improving your body composition. And so if you're somebody who wants to not only be healthier, but look better, then you're probably going to want to do some form of exercise. And lifting weights is especially valuable in that sense because you really can change the way that you look by building some muscle, perhaps in combination with losing some body fat. And the women who typically do that successfully really love those results.
Awesome. Um, this was an unplanned question. I'm curious what you think is the ideal body fat percentage from a health standpoint, not talking about aesthetics at all, but ideal body fat percentage for women. If you have an answer for men, I'm super interested as well. Because I've looked into that data and it's hard to get that answer. There's definitely things that we know, like, okay, you don't want to be 75% body fat, like that has detrimental health effects. But do you have an answer for like ideal longevity, what that range is?
Not really, because there are some inherent issues with measuring this.
Hmm.
I mean, you can do DEXA, for example, but when we look at the long-term data, we don't have enough to say, oh, other than what you just said, right? There are some limits that are probably not great. And then if we look at the bodybuilding type literature where you have people who are getting super, super, super lean, and then you see, oh, below a certain body fat percentage, there's a loss of menstrual cycle, or there's a major tank in thyroid hormone, those types of things when we were getting super, super lean. But the other thing that I think is really important is for reasons we don't entirely understand, there seems to be sort of a sweet spot body fat level for each of us. And
Yeah.
so, and that's where we're kind of comfortable, and we can get below that, but it's a lot of work to get there and to stay there. And I mean, you'll see this in daily life, right? There are some people who are walking around, they're really lean, and it's really easy for them to be lean. They're not working that hard for it. So I think there's definitely a genetic component as well.
Yeah, I completely agree. I end up telling patients, I would love for your feedback on this. If you're a woman, we're looking at most women below 20, can start to see hormonal changes or lose their cycle. Some women, I'm one of them, can maintain a lower body fat percentage and have a normal cycle. So there's exceptions, but I end up telling people between like 20 and low 30s for women in terms of body fat percentage. What do you think of that? Should I be more lenient with it? Or, I mean, I have leniency, but
I think that's reasonable. I'm generally not a huge fan of people using that metric
hmm,
because I think if, for example, you're using the scale in your bathroom and that has a setting that's giving you a body fat percentage, it's using a technology that's only measuring in one leg and out the other. If you have a similar device at your gym, maybe it has the electrodes where you're holding on to those handles as well. But this technology is highly influenced by your hydration and sodium intake from the day before, proximity to meal from the night before, all those things. So I don't love when people are constantly looking at this and seeing these fluctuations and thinking, I've, gone up a percentage since yesterday. You haven't gained fat since yesterday.
right,
So
right.
I think we need to be mindful about the tools that we use and understand where those limitations exist and kind of use them appropriately and check in at an appropriate frequency.
No, I'm so glad you mentioned that too, because I did not like lay the foundation of what these are for my concierge patients where we do DEXA scans like once or twice a year kind of thing, when we're getting a baseline. But I'm really glad that you said that because that's really important point. And that can create a lot of psychological stress too, is like chasing these numbers and they may not even be correct. So yeah, I get that.
And same goes for using scale weight as the end all be all as
Mhm.
well, because especially if you're somebody who is kind of new to lifting, you might see hey, my body is changing. I'm not losing weight, but my body composition is changing, and that's great. And so then we need to focus on the fact that your body composition is changing and you look different and your clothes feel different, and as opposed to being really tied to that scale weight. And we were talking about ways that we've kind of fallen into traps earlier, and for me, looking at scale weight as this like make or break of the day I was going to have. I mean, it can really, really affect people. And so I like to discourage that emotional attachment to the scale.
Yeah. Yeah, I just like flash back to my college gym. There was a scale in there, and I remember every time I go, I'd get on the scale. And yeah, a lot of emotions tied around what that number was. So, yeah, totally on board with that. Um, Appendicular lean mass index, do you talk about that at all? Do you think that's a good thing for us to be looking at? Again, if it's, from a DEXA or something that's actually somewhat reliable. But this is another tool that I use in my longevity practice where we're looking at how much muscle mass. And for those of you who haven't heard of it, appendicular lean mass index is almost like a BMI where you're taking a weight in comparison to your height. So for this one, you're looking at how much lean mass is on your arms and legs, which are your appendages, so appendicular, in comparison to how tall you are. So it's that ratio there.
I think it can have utility. I think I understand why it's used in research settings, especially when we look at people over time and aging populations, et cetera. Um, but I think whenever we focus in on one of these metrics, it always needs to be in combination with the other information that we have about an individual. Uh, Measuring muscle is tough
Mhm.
because we can talk about DEXA as being our gold standard ish, but it's not really measuring muscle. It's measuring everything that's not bone and not fat.
Mhm.
And so there are some issues with DEXA. And in laboratory settings, we're starting to use a stabilized tracer called D3 creatine, which is through a couple of urine measurements, you can, through a calculation, get an actual, probably more accurate muscle mass measure. And so I think that's a really exciting kind of new heights of muscle mass and body composition measurement because it could be that at some point down the road, that is something that can be used in clinical settings.
Yeah, that sounds so exciting to me, where we could get like a urine sample, send somebody to Quest Diagnostics, and get a urine sample. Not that we're there yet, but that's incredible. Um, and we're not there yet, so I'm gonna go back to where we are. But I want to know everything about that. Is that where are you at in that research? Where does it look really promising? Does it look kind of promising? Is it 50-50 at this point?
I think it looks very promising in terms of it actually working and measuring what we think we're measuring. It is quite dissimilar to DEXA, which is interesting. And in terms of it being something that is commercialized, I think we're really far away from that. But um, I mean, I think there's just a huge implications for it, for the use of it. And it's really in order to do the analysis currently, you need to use mass spec, and not everyone has mass spec. So only a few labs are doing this. But I think more and more will, as long as you can send out the urine for the analysis. It's actually a pretty straightforward analysis, and you can freeze the urine for an extended period of time before you necessarily send it out if you need to. And in these earlier studies, they were doing 24, 48, 72-hour urine collection, meaning you're collecting a whole lot of urine. But now what we've seen is you actually get really similar results from just doing spot urine 48 or 72 hours after you consume the tracer. So I think it's interesting, it's exciting, and I believe we'll see more labs start to use it, and then from there, hopefully, it will get a place in a clinical setting.
Yeah. And what is the outcome? Like, what does the result look like? So what's the actual number that you're getting?
You're getting kilograms of muscle
Kilograms of muscle
as
mass.
as
So it's not
measured.
kilograms of lean body mass. So we're actually taking out organs as well from that. It's able to differentiate.
Yeah, so what it's doing is measuring creatinine excretion, and so through the labeled creatine tracer, then you're seeing that excretion and output in the urine, and so arguably that is a better marker for muscle mass than some of these other measures that we use that, as you say, include um, non-muscle.
Yeah. Yep, yep, yep. Um, in that number, it's not just going to be skeletal muscle, though, right? You're also like, for instance, like the heart would be included on that number.
Yes. Uh, so there are ways to kind of estimate around it so that it is just skeletal muscle, but it's using a prediction equation, as are pretty much
Yeah,
all of these body comp estimates.
right.
So yeah, I think I can send you some papers you can
Yeah, I
do
would
some
love that.
reading
Please,
on.
please do. Um, all right, then we just went down a rabbit hole. Okay, pulling us back to DEXA. I know it sounds like it's not like your favorite tool. But with the appendicular lean mass index, you're actually taking out everything that's in the trunk, right? So you're just looking at the arms and the legs, which takes out some of that variable in terms of you're not looking at the organs that are in the thoracic cavity. And in terms of what you are looking at, it's like bone, fat, muscle in the arms and legs. So I'm just wondering if you think that the ALMI is an okay measure until we get something better. And the reason that we would use it, like I was saying, is to get just a baseline of is somebody under muscled or adequately muscled? Because I see this as being a big thing in women's health specifically, but in health in general. So I see men that are under muscled all the time as well. But the risk for osteoporosis for women and, just sarcopenia in general being two main factors that I'm really wanting to make sure that a woman has adequate muscle on their body that has a buffer for aging too, because we know that she's going to lose some as she ages. And sometimes the numbers are more surprising to me. I also do a lot of telemedicine, so it's not always possible for me to eye somebody and say, are they adequately muscled or not? But what are your thoughts about that utility?
Yeah, I think that makes sense. If you're looking at muscle or lean mass more specifically, of course, if you're interested more in overall body composition, then you might be missing out on the visceral fat situation if you're only looking at appendicular. But for I do think that there's a utility for it. But if you can't get that, I'm not sure it would change the recommendations.
Right. Yeah. Totally agree. In terms of, we're still going to be talking about resistance training. We're still going to be talking about all the basics. Yeah, absolutely. I've just seen it have an effect on people where it gives them a goal where it's like, okay, this is where I'm at right now. For instance, like an appendicular woman have an appendicular lean mass index of like 5.5, like to really say, okay, we really want to get you up to this number. And we can tell if we're getting you to a good place or not. And we always will use strength as a predictor. We always are talking about visceral adipose tissue as well when we're doing DEXAs because there's so much information that you can gather from them. But yeah, just that benchmark. Um, any physiological differences between men and women when it comes to exercise, performance, and recovery? Like anything at all. There's so much that we talk about, or not talk about, but we hear on social media. Anything that people should take away.
What I've learned, sort of going back to what we were saying before, is the difference between individuals is far greater than the difference between all men and all women. So I don't think it's useful to talk about exercise or training goals or training adaptations as they are related specifically to biological sex or dictated by biological sex. So I would never approach fitness with somebody one way or another based on their biological sex. I think it's really important, as I said earlier, that we have some level of individualization in how we prescribe exercise and how we work with people, because we need to meet them in a way that is going to be effective and sustainable and goal oriented. So, to that end, maybe in terms of physique development, one person might have a different priority than someone else, and we might see sex differences there. I've never worked with a woman who is super concerned about her upper trap hypertrophy or her pec hypertrophy. So there are certainly things like that that are going to be individualized. But in terms of what kinds of exercises we're doing, or rep ranges, or rest periods, or pre-workout nutrition, post-workout nutrition, all of that, the cycle stuff, perimenopause, it's all the same advice. It's
Yeah.
just customized to the individual.
Yeah. Yeah. It doesn't change as you get older. It doesn't change if you're a man or a woman, but we're really focusing on just the individual. Yeah. Which simplifies things. That makes it so much easier where you don't have to change things based on the time of month or, if you're perimenopausal versus if you are in your reproductive years. So that should be empowering, hopefully, for people listening. Um,
It
and
also allows for so much preference because there's
yeah.
flexibility. If you're someone who loves machines, then use machines. If you'd rather use dumbbells, then use dumbbells. If you want to really train for strength and sit there for 5 minutes of rest because you're after that 1 rep max, then you can do that, but you don't have to. So I think it's good news that we have all of this choice, because it's hard enough to get people to do resistance exercise at all. And so the fact that we can say, hey, do it, and do it any way you like, it is really good news.
Yeah. Okay. And I'm going to play devil's advocate where something that I've heard somebody else say is, hey, I'm a woman. I think I should do Pilates because I don't want to get bulky. So I don't want to lift heavy weights. What's your response to that?
Pilates will be effective a little bit in the beginning if you've never done anything else.
Hmm.
So that's really true for cycling, even incline walking. You might gain a little bit of muscle from doing anything at all in the beginning. But if we want to optimize muscle mass and growth, we really need to have more of a stimulus. And Pilates, even when we look at reformer, the resistance isn't enough. It feels challenging because you're trying to move against resistance in an unstable position, which really compromises the amount of load that you can push against, which compromises the amount of force you can produce, which is just really suboptimal for muscle growth. As far as getting bulky, we know that those who have huge muscles work really, 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 really hard, and often will have some assistance pharmacologically to get that huge. Nobody ever got super muscular by accident. Um, so I think we need to move away from that narrative. And when people, women often will say, "Oh, but I want to be toned," or "I want those long, lean lines," or "I want a dancer's body," or these sorts of imagery is evoked. And what you're saying is you want visible muscle. And so either you need to have larger muscles, or you need to be leaner, or in some cases, it's a combination of both. But the answer is always to put on some muscle, because that's going to improve your goal, your body composition goal.
Yeah. And what you just said about the Pilates, and again, any exercise is better than no exercise. So I think that needs to be a through message here. But that it's not enough resistance at a certain place once somebody plateaus to initiate changes in the muscle. Would you also say for the bone as well?
Yes, I would. I mean, what we see for bone is you probably are going to want a combination of resistance exercise and some kind of aerobic exercise. It doesn't have to be jumping, it doesn't have to be sprinting, but something with some impact, and then challenging resistance training. It doesn't have to be super heavy, but if it's going to be lighter loads, then we want to do enough repetitions with those lighter loads that you could maybe only do one or two more, and then you'd be done. So uh, we need to make sure what we're doing is challenging and effective. So if you love Pilates and you want to do Pilates, then great, continue doing that. But I would encourage you to add, even if it's just 20, 30 minutes a week of a more standard resistance training program. You can do the circuits of machines at the gym if you have one. That can make a big difference.
Yeah. At a load that is challenging, is what I'm hearing you say. And you were talking about like 2 reps in reserve or something like that, where that means that when you're done, that you could only do maybe 1 or 2 more, right? Like if you're done and you're like, yeah, I could easily do 10 more. What would you tell that person? We're thinking about
Then
muscle,
it's not challenging enough, right?
not
So,
challenge. Yeah.
I can sit here with my pen and I can do curls for the rest of this conversation. This is not a good enough stimulus for me.
Yeah.
Um, and so if it doesn't feel hard and uncomfortable at the end of your set, then you're probably not pushing yourself enough. And when I worked with women who are new to the gym, it often it will surprise you what you're capable of doing once you try and once you really push yourself and once you get comfortable with the fact that lifting weights is kind of uncomfortable and it's going to be challenging, but then you can push through and you'll be able to do more over time. So what's challenging today might change next month, and that's great. That's what we want.
Yeah. This is one of the most common things, especially for women, I would say. It feels like a little bit more where I think women underestimate how much they can actually lift. And, I see and I'm really pushing them and saying, like, what do you think you could have done in terms of total to failure if you had to? And there's just this underestimation. It's also just a really hard skill to learn is like, what is your true max until you've actually gone there multiple times. Not that I'm recommending do that, but it is a skill in and of itself is determining where you're at in terms of failure. But when a woman says, but I don't want to get hurt, how do you balance doing things safely with taking yourself to the point where you're going to get adaptations of the muscle and the bone that are beneficial for health?
I think starting with good technique is always very, very important. But keep in mind there are certain exercises that are more technically challenging than other exercises. And like I said before, there is no exercise that you must do. So something like a deadlift is a challenging technical lift to master. And so when we are trying to do something like that, and then we add a lot of load, then you're setting yourself up for a higher injury risk. But if we think about something like a machine leg press or a machine row, where you're really anchored into a seat, you have something to hold on to, and the movement path is really clear, then there's not a lot of room for error in terms of executing that movement pattern. And therefore, the injury risk will be quite lower. And so, not to say don't do deadlifts, but with barbell exercise, free weight exercises, you do need to be a bit more aware of your your technique and making sure that as you add load, you're not compromising that technique. So I think if you're somebody who is really nervous about that, then I would at least start with machines and then you can move on from there.
Yeah, I think that's a great recommendation too, is start with something that feels safer for you and then build from there. You can get great results with machines too.
I love machines.
Same. Any truth to this idea of toning versus bulking for women? Bulking's an
No.
interesting term in and of itself, but
Um, no, I mean, like I said, this inappropriate use of the word toned is really just describing some visible muscle with a lower body fat percentage.
yeah,
And so, in order to look that way, you can have smaller muscles if you are extremely lean. But if you're somebody who has some body fat to lose, and you're worried about, oh, if I put on muscle, I'm going to look even bigger. What the truth is, if you are able to change your body composition by increasing your muscle mass and decreasing some body fat, then you will start to see that shape of the muscle, which is what you mean when you say, I want to look toned.
yeah, yeah. Um, I'm going back to college a lot on this podcast, but I remember in college that when I would go to the gym, it's better now, and I don't know if it's regional because I was, on the East Coast then, but most of the women would be on the cardio machines, and then most of the men would be weightlifting. And I think many women still believe that you just need to do more cardio to lose fat. What's your take on cardio versus resistance training when it comes to body composition optimization?
I think being overall physically active is a good thing to aim for. And by that, I don't mean structured exercise. I mean park further away from the grocery store so you get more steps in, or just trying to be a bit more physically active throughout your day. When it comes to structured exercise, the energy expenditure from 30 minutes on the treadmill or Stairmaster is really disappointing. Um, and so if we want to lose body fat, we're going to prioritize the diet and then have that physical activity or cardio as a backup plan, or something that we're doing in conjunction with it. But the meat and potatoes of that fat loss is really probably coming from your diet. And meanwhile, we want to make sure that we're losing as much body fat as possible and not as much muscle as possible. So if you're losing a lot of weight, you'll probably lose some of both, but hopefully we want to lose more fat and maintain some of that lean mass. And so that's why resistance training is really important, not because you're burning a ton of calories from really either type of exercise, but because we want overall improved body composition, less body fat, more muscle, and that's better for health and it's going to be better for your physique.
Yeah, 100% agree. What do you think the most misunderstood aspects of female fat loss and metabolism are that we haven't talked about? Maybe we've covered all of them, but anything else?
That women specifically are fat loss resistant, or that a calorie deficit doesn't work for women. I'm seeing that a lot lately, which is
Hmm.
a little bit infuriating. Um, and it's misinformation. We have data that women can lose subcutaneous fat, visceral fat from a calorie deficit. It When we compare men and women, you'll often hear this narrative of, well, my husband loses weight and I don't.
Yeah.
And one thing that we need to keep in mind is your maintenance calories. So let's say the amount of food that I need to eat and amount of energy I'm expending throughout the day. There's a certain range for me to maintain my body weight. So if, let's say, my range is around 1,800 calories to maintain my body weight, I'm going to need to decrease that in order to start to lose weight. If my husband's calories to maintain his body weight are 4,000, then when he has more room to cut before it starts to be a painful dieting experience, right? And so I think that often that's what's happening, especially
Mm,
because if you have a partner or you're eating with your family, maybe you aren't intentionally eating a smaller portion than somebody you live with who just has a higher um, you know, maintenance caloric intake because they're a bigger person. And so they do, if you, the higher you start, the more room you have to drop. And we're also often inadvertently dishonest with ourselves about what we're eating throughout the
yeah.
day.
Yeah, I
Um,
logged my food for the first time in a really long time yesterday because I have a new goal that I'm trying to hit, and I found I was like, wow, this is a really good exercise to do once in a while because I'll do it with patience. And I'm like, I look at the end of the day, I'm like, okay, I entered all my food. And I was like, wait, did I? And I went like step by step and I'm like, nope. I had like these little basically starbursts. Like I didn't log that. Like there were so many things that I really thought I logged it all. And it wasn't until I like scrutinized my day and I was like, wow. And it was an extra like 500 calories or something that I could have potentially missed.
I think that's really common. It's especially common if you're somebody who does a lot of cooking and you're kind of eating while you cook.
Mm,
And also if you have younger kids and you're eating your kids' snacks or you're finishing their plates because they won't finish those types of things that you don't think of as, oh, that was my meal, it's still going to add up over the day.
yeah. Yeah, totally agree. Is there any other reasons why it seems harder for women to lose weight than men besides what you said? Like no physiological changes, really. It's a matter of what sounds like a change in lean body mass. Men are just bigger than women most of the time, not all the time. Um, Nothing else.
And women do typically have higher body fat percentages than men.
Right.
So it's true that our starting points there are different. When it comes to the menopause transition, there is, in some cases, a shift in fat pattern distribution, meaning you
Yep.
are getting more fat around the midsection for reasons that aren't fully understood. Uh, we can kind of speculate about estrogen, but we don't really understand why that's happening, why it's not happening in everyone, why it happens to different degrees. But I think there's that element too of people who you didn't actually gain fat, it's just redistributed a little bit so it looks different.
Yeah.
But again, calorie deficit is going to
Still gonna work.
address that.
Yeah. Yeah. Um, That's interesting that you said that we don't know if it's just estrogen which I mean that it makes a little bit of sense that maybe there's something else at play there because you put women on estrogen and it doesn't always go away. It's not like it's this, easy to fix tool on 100% of women.
I think the menopause transition is also a period of change that affects physical activity and diet. And so,
Hmm.
again, often we're inadvertently making changes. But and for women who are experiencing really difficult symptoms, sometimes those are going to affect the decisions that you make around your training and nutrition. If you're somebody who's up all night with hot flashes, night sweats, and night after night you're getting terrible sleep, that's not setting you up for being really motivated to go crush it in the gym or adhere to your diet.
Yeah, great point. Protein has been in the spotlight, I would say. It's been on the red carpet for a few years. People are talking about it, which I think is a good thing overall. But how much protein do you think that we need? If for a woman, let's say she's trying to put on 5 pounds of muscle, so she wants to put on some lean mass, what's the number that you use?
As a minimum, I would say 1.2 grams per kilogram.
Okay.
And you'll see numbers that are higher. And it's fine to eat more protein than that in the 1.6 range, let's say 1.8, even higher. It's not bad to eat more. Some people like that because they say it's satiating, and so it's easier for them if they're trying to lose fat to be on an even higher protein diet. What we do know is that the RDA for protein is too low. There is a benefit to bumping up from that point 0.8 to the 1.2. But when you start to look at the differences between that and higher and higher and higher, they're kind of underwhelming. And so I think and what I hear from some people is I'm having so much trouble getting all this protein in. And so I think it can be relieving for people to hear, you know, if we're talking about this minimum, it's maybe three-quarters of what someone told you it was.
Yeah, no, I agree. And I think it's like knowing the person too, right? Where if you tell them, with 1.2, like let's just say like 70 grams of protein, right, is the goal for like what would that be, like 120, 130 pound woman or something. Um, but if you tell her 70 grams, some women will then hit maybe 40 or 50, right? So it's just knowing too, are you somebody that's going to always reach the goal, or, do you need a little bit higher of a goal because you're going to fall short anyways? And I think that's just practice.
Yeah, and I think in some circumstances, it's just, hey, start having a protein shake every day. And we know that at least from where you are, then that's going to bump you up. Maybe we're not getting quite there, but it's going to be better than where you're sitting now. And that's an easy change.
Right. Just add one protein shake per day. Great. And does timing of protein matter? Does it have to be after your workout within an hour? Do you have to eat something specific before? Like what? I know you've talked about this on social media, so I want to get that here.
There's so much information out here on this that is just not backed by the evidence. In fact, we have substantial data to support the opposite, that nutrient timing is not important. We once thought that fasting might be this game changer for fat loss. It's not. Fasting is a tool you can use to create a calorie deficit if that works for you. But in terms of the ability for you to lose fat, gain muscle, whether you are training fasted or training fed, those are equal. So
Mhm.
if you're somebody who feels better having something to eat beforehand, go for it. If you're someone who would prefer to train on an empty stomach, that's completely fine too. When we look at this idea of a post-workout, anabolic window, really the resistance training sensitizes the muscle to subsequent nutrition for hours and hours and hours and hours after that session. So there's nothing magic about that 45 minutes or even an hour. If we want to focus on getting adequate nutrition uh, throughout the day.
Yes.
So adequate calories, adequate protein, but worrying about timing that in any way, shape, or form around your workout is not going to influence your fat loss or your muscle growth results.
Phew. So we're looking at total daily intake when it comes to calories, protein, like simplify. You don't have to freak out if you don't have your protein shake after your workout, as long as you're hitting your daily protein, on average, even requirements. Um, then you're good to go, it sounds like.
Yes.
Yes. Carbohydrates. I feel like they're like the redheaded stepchild right now, where we're talking about protein and its importance. And I think people are now getting on board that calories matter. It feels like we're shifting a little bit away from the calories don't matter fad that I know it's still going on, in terms of there's influencers that say it's the quality of your food. It doesn't matter how many calories you eat. Um, But I feel like carbohydrates are hiding in the shadows. And when it comes to athletic performance, I just had Seb Zorn, who's the LA Rams dietitian, on my podcast. And it's interesting to talk to somebody in that field where they talk a lot about carbohydrates and how important they are in terms of refueling and athletic performance. But what do you think, just for the person? Let's again just use that same archetype. She's trying to put on 5 pounds of muscle. She's doing her resistance training now. She's really dedicated. She grew up in the era of, carbs make you fat. So she's a little bit probably shy of carbohydrates. What do you think percent of calories should come from carbs for that person, just in general? Does it matter? Does it not matter?
I like to focus more on setting the protein target,
Hmm.
making sure we're meeting at least a minimum for fat, and then letting the rest be sort of decided on preference.
Okay.
Unless you're somebody who is doing 2 workouts a day or high intensity, long distance endurance training, then I think we do need to make sure that you're properly fueled. But I rarely see somebody who is eating a sufficient number of calories and really underdoing their carbohydrate intake unless they're on a strange diet, like
Yeah.
a super high fat diet. Because in order to like a carnivore type diet
Hmm.
is what how you might and um I know we see a lot of that on social media. I don't know if you see any of that in practice. I've never met
Hmm.
anybody who does that diet. But I think as long as you're not doing some sort of extreme dietary practice like that, then we're probably not going to have an issue with getting sufficient carbohydrates to fuel your basic exercise. And I like to be able to say, hey, you have some flexibility here. If you're somebody who prefers a bit higher fat, then go for it. If you're someone who prefers a bit, because people typically do have a little bit of a preference. And again, I'm not speaking in those extremes.
Yeah.
I'm just in a kind of more quote normal diet.
Yeah. Yeah. And where is that line where it's like, okay, yeah, this could actually be affecting your ability to recover? And again, we're not talking that they're this, Olympic endurance athlete, but they're doing cardio several times per week just for general health, and they're lifting 3+ times per week to gain some muscle. Is there a lower limit of carbs that you're like, that actually is getting on the lower side?
Well, I think if we were to say, here's your 1.2 grams or let's go back to your example and say, here's your 70 grams of protein that we're aiming for. And then as a minimum, we'll say 40-ish grams of fat. You could argue it could be a little lower, but I think that's probably a minimum to start
Mhm.
at. And then if we're filling the rest in with carbohydrates, then I think we're fine. Unless we're in a situation where somebody just is not consuming enough calories, period, in which case then this is something that we would need to address because if you're somebody who's chronically underfueled, then there are a whole host of downstream effects that can influence your hormones, your muscle, your bone, your immune system. I mean,
Totally.
everything. It
Yeah.
can be really, really compromised.
Yeah. How are you calculating fat then? It sounds like you're calculating protein, then you're calculating fat. Is there a percentage of calories that you're using, or what's your,
What I would look at to get in your essential fat. So if we look at, what essential fatty acids do we need? How are we covering that? Um, are we consuming enough fat that we're not going to run into some hormonal disruptions? So I think that's where I'm kind of getting the 40-gram minimum from.
yeah.
Of course, it will depend on the person and their overall calories and all of that. But if we were just to say like where do we not want to go below, then I think that's probably a reasonable number to throw out there. But certainly I would expect most diets would have more fat in there than that. But again, if you're somebody who prefers higher carbohydrate food, then your diet might naturally only have 55 grams of fat in it. And that might just be what shakes out because you're someone who isn't eating a ton of cheese, isn't eating a lot of fatty meat, uh, isn't eating a lot of nuts or nut butters, and you'd prefer to eat some rice and some fruit. And so I do think we should allow for some preference in there as well, because there are many ways to eat a nutritious diet, and that can be higher carbohydrate or higher fat and still be well-rounded and nutritious.
Awesome, awesome. I should have asked you this at the beginning. Do you have a hard stop right now? Do you need to? We're at the.
No, I'm okay.
Okay, I just have a few more then. Um, are there any markers that you personally track for your fitness? Yeah.
I think I loosely track strength,
Mhm.
um, just to know that I'm not getting too much weaker. Um, but and I try just generally to make sure that I'm eating a sufficient number of different fruits and vegetables to kind of make sure I'm getting adequate micronutrients. But otherwise, I don't get really bogged down in tracking a lot of metrics. There was a time when I tracked everything,
Same.
very, very diligently. And I think it can be a valuable learning experience for sure. It's worth doing for a short amount of time. It teaches you about portions, and it allows you to then move forward with the tools to eyeball what is 20 grams of protein, what is a half a cup of oats, or whatever the thing that you're measuring. But I think doing it long term, at least speaking from my personal experience, was not good. Made it so that I didn't want to interact socially because I didn't want to go out to restaurants, and I was measuring egg whites, and just it can get too extreme.
Yeah. Yeah, there's a line between like the obsessiveness that can take over versus getting a good sense of what your baseline is. But I've been down that journey myself personally too. And I think it's like don't throw out the baby with the bathwater because I think there's people that have never logged food ever in their life and they have no idea what they should be consuming. And it's really educational process, like you said, to say, okay, this is a tablespoon of peanut butter. It's like, okay, I was
Yeah,
eating a half a cup before or something, thinking it was a tablespoon.
that's the saddest one to measure.
Bad, bad. Yeah. They have these new measuring devices that came out just, I feel like it was just for peanut butter, where have you seen it on social media? It's one thing that I'm like, oh my God, I'm going to buy this on social media. But it's this flat thing and it turns into this little cone that you can scoop the peanut butter up with. And then you can, I'm not doing this justice, but you can like scrape it into the blender and it flattens back out versus, if peanut butter's in a spoon, you
Ah,
couldn't. It's really
yeah,
hard.
you're kind of knocking it out. Okay.
I'll find the name, put it in the show notes. No
Yeah, I
affiliation.
think that for sure, if you are somebody who's never tracked before, it can also just the exercise itself can make you more aware of what you're currently eating, because if you have to write it down or log it in an app, sometimes you'll think twice about, do I really want this handful of whatever it is? And sometimes you won't eat it.
Absolutely. Yeah. And disclaimer, I always bring this up, if you have a history of body dysmorphia, eating disorders, might not be in your wisest choice to track. So maybe something to talk about with your practitioner.
For sure.
Um, and one other thing I wanted to ask you before we go into rapid fire round, which I'm excited for, is in when we're talking about strength, are there any benchmarks that women could consider as markers for strength? We talk about grip strength, which we can measure. Some people talk about a dead hang, being able to do that for 90 seconds or, X amount of push-ups. But are there any things that you think that are warranted as just a benchmark of like, okay, if this is the goal for a woman to be healthy, to have some sort of thing to compare themselves to in terms of strength?
So we use these types of metrics in research because they're really easy to do on a large number of people,
Mhm.
and it's not technically challenging. Like, I
Mhm.
don't need to teach you the skill of like, squeezing this thing for grip strength. Um, but the people who are going to perform better are the people who have more muscle and are stronger just in general. So
Mhm.
I don't know that we should be training for better grip strength. I
Yes,
don't know
totally
that we
agree.
should be, doing that these dead hangs. And I've seen the push up thing, and I don't like that message either because the person who said all women should be able to do 11 push-ups, um,
Oh, I haven't heard
strict
that one.
push-ups.
Okay.
Uh, so this the data that is being relied on was a study of male firefighters
Oh,
and
I do
looking
that
at
note study. Okay.
relative risk of cardiovascular disease, I believe,
Mhm.
and the people who could do more push-ups had a lower risk.
Mhm.
So then to say all w women should be able to do this, I think is a big jump, probably an inappropriate jump, because there are plenty of people who don't want to or can't do push-ups because of wrist discomfort. And that's fine. You can get stronger, like we said, doing machines. You can do a machine bench press or dumbbell press if you want to develop the pushing muscles. But I think in I would like to see a focus more on a simple but well-rounded training program that involves doing some pushing exercises and some pulling exercises for your back and some lower body exercises, and then getting gradually stronger over time doing those exercises because then we know you are building well-rounded muscle that is going to serve you for the
Yeah.
long term. I think it's more effective and efficient to focus on that type of prescription than it is to be really held up on some of these lab techniques like
Right.
a VO2 max, like grip
Yeah.
strength.
Yeah. Yeah. That makes sense. Okay, rapid fire round. I do this after every podcast. You're gonna hate it because we don't get to talk a lot about nuance. So we're gonna try to put nuance on the side. You can always say there's nuance here. You can say it, but we're not gonna go into it because the point is just like quick questions, quick response, and just like what comes top of mind too. And some of them are silly and some of them are serious. You ready?
Yes,
Creatine, is it a daily essential or overhyped if money is no factor?
overhyped.
One supplement you actually take every day, if any?
I don't take anything every day.
Nothing. Most underrated exercise for women?
Hip thrusts.
Love it. Worst advice you still hear in the gym?
You have to squat, bench, and deadlift.
If you could ban one phrase from fitness culture, what would it be?
Hormone balancing.
Any fitness trackers or wearables you would actually trust?
Maybe heart rate monitors if you're wearing the chest strap.
Cool. Would you rather lift with perfect form or progressively overload at a faster rate with decent form? Or none of the above?
Mm, I'm gonna stick with perfect form because whenever I've done the alternative, I end up tweaking something and then I'm out for a week, so it's not worth it.
Respect. Deadlifts or squat if you had to pick one of them forever?
Mm, Deadlifts.
I'm going squat. You're on a desert island. This is one of the silly ones. You're on a desert island. You can only take three foods with you. What are they?
So, do I have a refrigerator?
Yep, for sure.
Okay.
Of course.
Mm, you're really putting me on the spot here. I'm going to take frozen ahi tuna steaks because I can
Hmm.
have those either lightly seared or as a poke bowl. And I'm gonna take um, popcorn
Solid.
and peanut butter.
Okay. You're gonna have a weird meal. I like it.
That's right.
Okay, you're still on the desert island.
Oh
Desert
no.
island, desert island. Assuming you now have ample food to replenish, but no gym equipment, three exercises you're going to do if you can only do three.
And I have no equipment.
No equipment.
Okay. I will do walking lunges, push-ups, and I'll find something to hold on to and I'll figure out some kind of rowing or pulling movement.
Oh yeah, I love it. Like a rock and a
Yeah.
vine or something.
Strong branch and I'll do
Yeah,
some
I was gonna
incline.
pull-ups. I feel like is an easier one, but yeah, I love the pull. Okay, that the pull is the most creative thing I could have thought of actually. So you win for that. That's all I've got for you. I love that we ended on that question too. Thank you so much. Again, I'll put your information in terms of your Instagram, anywhere else people can find you in terms of content. You've been on a ton of podcasts, so they can put your name in Apple Podcasts.
Yeah, anyone who's really interested in a deeper dive into the science itself, check out massresearchreview.com. I publish that monthly with three other PhDs who have areas of expertise that are slightly different than mine, and we cover all things training, nutrition, recovery, supplements.
Great. And we'll put that in the show notes as well in terms of the website. Thank you so much, Lauren. It was such a pleasure chatting with you. And thanks for all you're doing in terms of debunking the things on social media and keeping health simple and actionable. Really appreciate it.
Thank you so much.